Hi, I'm Dr. Yip. I'm a pediatrician from Happy Kids Child Specialist Clinic in Taman Mega, Petaling Jaya. The main purpose of screening tests is early detection and early treatment. Some serious health problems among babies and children do not show any signs or symptoms in the early stages. Every newborn baby in health facilities will undergo examinations to assess baby's well-being. These checkups would include physical examination, blood examinations, and other specific examinations. They are mostly non-invasive and do not cause pain to your baby. Physical examination is performed to detect any significant abnormalities. Apart from that, blood from the umbilical cord is tested for conditions such as deficiency in the G6PD enzyme and deficiency in thyroid hormones. Nowadays, a lot of hospitals also carry out screening for hearing and critical congenital heart diseases. We start with G6PD. Okay, what is G6PD? G6PD stands for glucose 6-phosphate dehydrogenase. Okay, this is an enzyme in the red blood cells. It acts to protect the red blood cells from hemolysis, which means breakage of red blood cells, when exposed to certain medications, food, or infections. G6PD deficiency occurs when there is reduced activity of the enzyme in the red blood cells. G6PD deficiency is very common in Asian region. It is an inherited condition that is determined by the X chromosome. This explains why most of those affected are males, while females are usually carriers. Most people with G6PD deficiency are asymptomatic. Newborn babies usually are known to have this condition by screening. Newborn baby with G6PD deficiency may develop jaundice rapidly due to excessive hemolysis, which means breakage of red blood cells, and therefore require treatments such as phototherapy to reduce jaundice. Signs and symptoms of hemolysis including jaundice, look pale, tea-colored urine, lethargic, or tiredness in older child, dizziness, rapid heartbeat, chest pain, and difficulty in breathing. G6PD deficiency is a lifelong condition. It does not have any negative effect in affecting growth and development of children. However, adults and children with G6PD deficiency need to understand the condition thoroughly. They need to avoid certain medications and other things that can lead to hemolysis. Next, we come to deficiency of thyroid hormones, or we call it congenital hypothyroidism. Congenital hypothyroidism is caused by inadequate amount of thyroxine being produced, and this causes a child to have mental and physical disabilities. Data from Malaysian studies showed a local birth prevalence of about 1 in 3,000. Newborn baby usually will not show any signs at birth. If the condition is not detected early and not treated, the child usually has signs or symptoms of congenital hypothyroidism at around few months of age. Babies detected to have congenital hypothyroidism need to be treated as early as possible. Delay in starting treatment will cause mental retardation and developmental delay. The treatment is to replace the thyroxine hormone that the thyroid glands fails to produce. Okay, the next screening test is baby's blood group and rhesus factor, which is done in most private hospitals routinely nowadays. Some hospitals also offer IEM screening. Now, IEM is inborn error of metabolism. IEM actually comprises a group of genetic defects that affect the metabolic pathway in our body. There are more than 400 types of IEM diseases identified. The overall incidence of IEM is 1 in 4,000 live births and is affecting all races in the world. Only few drops of blood needed for newborn IEM screening. It is able to detect up to 30 to 40 types of IEM diseases. With screening, early diagnosis can be made and prompt treatment can be instituted. Genetic counseling can also be provided. Therefore, it is important for early detection by screening the newborn babies before they become sick. Hearing is one of the important senses for speech and language development. Babies who are born with hearing impairment, their speech and language development will be affected. Hence, hearing screening is very important. If hearing loss is detected in a newborn baby, the severity of impairment can be determined and the rehabilitation process can be implemented as early as possible. Therefore, the effect of hearing loss towards the speech and language development can be reduced. Hearing screening is usually done before the baby is discharged home. The hearing screening is also easy to be done while baby is sleeping or after feeds. Baby with an abnormal result may have hearing problem and need to undergo further diagnostic tests to determine the level of hearing loss. Next one is screening for critical congenital heart disease. Okay? This is carried out on newborn babies through an examination of oxygen content in the blood using oximeter equipments. Critical congenital heart disease represents a group of heart defects that cause serious and life-threatening symptoms and require intervention within the first days or first year of life. Some babies affected with critical congenital heart disease can look healthy at first, but within hours or days after birth, they can have serious complications. Pulse oximetry newborn screening is a non-invasive test that measures how much oxygen is in the blood and can help identify babies that may be affected with certain types of serious or critical heart conditions with lower level of oxygen in the blood. If detected early before they leave the hospital, they can be supported and managed accordingly. As some conditions will not be obvious or detected at birth, it is imperative for routine baby visits to pediatricians for body checks after discharge from hospital.